Hello everyone, myself Dr. Pradyot, founder and director of Movement Maestro Academy. Welcome you all to our global platform, Movement Maestro Academy official YouTube channel. Today we are going to discuss on role of physiotherapy and ergonomics in prenatal, antenatal and postnatal care. For this session, I am glad to invite our renowned resource person, Dr. Aditi Kulkarni ma'am. Over to you, ma'am.
Hello everyone, I'm Dr. Aditi Kulkarni. I'm a consultant physiotherapist and ergonomist. I'm one of the directors of the Active Physiotherapy and Ergonomics Clinic. Now I have associated with one of the hospital as an HOD in the Hyderabad as well. I have completed my Bachelor of Physiotherapy, Fellowship in Sports Science, Cardiac Rehabilitation. I have completed my post-graduation diploma in exercise medicine. Also, I have completed my post-graduation degree course in clinical research and management. I am mostly associated with the sports injuries as well as the cardiac rehabilitation, then the respiratory physiotherapy, as well as the clinical practitioner. Today, I am going to cover the role of physiotherapy and ergonomics in the pre and postnatal phase. Most of the time in the previous sessions, I have covered ergonomics for the footwear, ergonomics in a different field. Other than that, I have taken sessions on the sports injuries. Sometimes I've taken in the cardiac rehabilitation, sometimes I've taken in the respiratory, which are my specialties. But today I am going to cover the role of physiotherapy and ergonomics in the pre and postnatal phase, because recently I had been through the beautiful journey of pregnancy to becoming a mother, and now I can share my experience, as well as I have already experienced all these things, so I can tell you what exactly is the role of physiotherapy, what are the actual myths, and what are the things you can actually implement in your daily routine, and as well as how exactly you have to take care of yourself in the pre and the postnatal phase of your life, because that is one of the most important period of in the female's life, and we have to take care of ourselves, but we don't know how exactly we can help each other, or otherwise when to seek a physiotherapist help, and when to stop the physiotherapy, when to continue physiotherapy, what are the things physiotherapist can cover up, what are the things physiotherapist can teach you, and what are the things you have to ask to the physician or the any kind of a gynecologist or the obstetrician. So those are the things in this following sessions I'm going to cover up. In today's session, we'll basically focus on the role of physiotherapy and the corrected postures in the most beautiful phase of woman's life, from the conceiving pregnancy to becoming a mother. In most of the country, healthcare providers focus on the ANC, that is antenatal care, which is the pre-delivery phase, to have a healthy mother and a baby. But according to me, or according to the all medical fraternity, actually antenatal care as well as the postnatal care are equally important for the mother and the baby's health. We personally feel that physically and a mentally healthy mother can deliver a healthy baby, which can be mentally and physically healthy too. Antenatal care is something which is a person the woman who has conceived, and now that the journey has started of becoming the pregnancy to conceiving, and now that baby is started developing in the womb. So it is like the care of the woman during pregnancy. The primary aim is to achieve at the end of the pregnancy is a healthy mother and a healthy baby. It starts immediately from the time of conception, because most of the people think that it is going to start after the 4th and 5th month, so that we can join the exercise therapy, we can do meditation or some sort of an care which mother need. But it is the beautiful phase, and you have to start understanding that the baby has already started developing in your womb. The first heartbeat you have already heard at the 6th or the 7th week of your ultrasonography. So that time you immediately come to know that you are a pregnant person, and you have to take care of yourself as well as your baby in the each and every aspect of your life. So that's why I have written that it start immediately from the time of conception. you came to know that you are pregnant, and now the baby is inside your womb and has started already developing. All the feelings of the mother, all the circumstances the mother is going through, what are the fitness exercises a mother is doing, how is the respiratory capacity, how is the bowel and bladder movement, how is the constipation condition, how exactly that woman is dealing with the urinary issues, how exactly she has a hormonal imbalance, what are her vitamins and the proteins levels inside her body, how exactly is the hemoglobin percentage inside her body. Everything is going to get affect to your baby. So it's important that you have to start antenatal care. Can be having a good food, can be having a healthy atmosphere at house, can be it can be a good exercise therapy which you can give it to your body. You can consult a good physiotherapist and you can start doing an exercises for yourself. Otherwise you can join many classes which are known as the Garbha Sanskar classes. So those are the things which you can start immediately from the time of conception. There are multiple changes are going to happen at the time of pregnancy. That's why we generally say it's a second birth of a woman when she deliver a baby. So a lot many physiological changes she is going to undergo at the time of her pregnancy. There are respiratory changes, there are endocrinal changes, cardiovascular, then the reproductive, renal, and the GI tract is going to involve. There are major issues happen with the musculoskeletal and the postural thing. Neurological issues also sometimes they can face, can be nerve compression issues because of the increasing weight in the womb, and as which is putting a pressure on the spine and which is again causing a compression of the nerves. During pregnancy, even before the bump starts showing, actually the bump starts showing, the body goes through the major changes. The posture and the way of body moves change, because the person is going to stand upright, but still the womb has already started getting expansion. Now the weight, the center of gravity has started shifting anteriorly, and that time it is going to be the laxity of the muscles, ligaments, and the soft tissue. They become more flexible, elastic. They allow the pelvis to stretch to accommodate the baby. All these changes happen due to the hormonal changes, and they are very important for the baby to grow inside your womb. They need to occur for the body to prepare to create a beautiful human being and to allow the baby to grow in the tummy during roughly the 9 months that which is going to follow in the following duration. The center of gravity changes, there are more pressure on the organs, and there is increased weight to be carried. All these in the relatively short period often leads to the back pain, pelvic pain, and the urinary incontinence. Urinary incontinence, pelvic pain, and the back pain are the pretty common issues. There are multiple other issues also can get involved into the female's life, but otherwise we generally focus on these on a daily basis. These are the things which are definitely a female are going to experience. In the hormonal changes, there are hormones which are going to start acting on the ligaments, the soft tissues, and the muscles, which automatically causes the expansion, which increases in the body weight because the baby has already started developing in the womb, which increases in the abdominal size due to the growing uterus. If there are some abnormalities are happening inside the uterus along with the baby, can be the fibroid, then the more expansion is going to happen. Then the again female is going to suffer more, because fibroids and everything along with the baby is going to require more of the hormones to develop along with your baby. So those hormonal changes, increase body weight, increase abdominal sizes, automatically causes n number of musculoskeletal changes inside your body, which you have to take in consideration from the day one when you start having antenatal care. There is a increased water retention which is very specific, female are going to face from the conception till the 9 months. Increased water retention which causes actually the edema and the nerve compression. That's why female face a difficulty at the time of walking. Sometimes there is a face puffiness. There are a lot many hormonal changes are happening. That's why they put on a lot of weight, as well as the belly is also increasing. But those are completely a normal thing which is going to happen because of the increased water retention inside your body. Sometimes the nerve compression can lead to the carpal tunnel syndrome, DeKervan syndromes, or otherwise there is a sciatic pain. Otherwise, there can be a foot drop kind of a thing. Very rare cases foot drop kind of a thing can happen. But otherwise, sciatica, then the carpal tunnel, otherwise the compressions are going to happen very often because of the increased water retention. Drop in the pelvic floor. The pelvic floor dysfunction is particularly female face quite an often. Painful muscle cramps can be a restless leg syndrome also can sometimes it can lead to a very rare condition is a restless leg syndrome. Painful muscle cramps are pretty common in the female at the time of pregnancy. Pregnancy associated osteoporosis, which is pretty common in the female who are already deficient of the calcium, vitamin D, vitamin B12, or other kinds of things which are requiring for the baby's growth on a daily basis. If they are lacking already, and then again because of some issues they are not able to take the supplementations, can be the constipation, can be due to a severe vomiting, can be the hyperemesis gravidarum kind of a condition, then that time pregnancy associated osteoporosis is pretty common in the female. So we have to take all this kind of an history into consideration of the female, and we have to design the physiotherapy protocol for them in the phase of antenatal care. Diastasis recti and the diastasis pubis is one of the thing which most of the female at the time of physiotherapy practices I have treated. Diastasis recti is something those muscles get lax. There is an increase in the distance because of the increasing belly. And the uterus is growing inside because the baby is growing inside the uterus, and the muscles are spreading a lot. If you are already an obese person, if there is a lot of weakness in your abdominal muscles, if you are not into exercises at all, not even in the simple walking also, then there are multiple chances that you will face a diastasis recti. Diastasis pubis is something which is again the laxity or the hormonal changes which are happening inside the body. The muscles are going to get into the lax, then the ligaments also get lax, then the soft tissues also get into laxity, and the distance increases, and there is a lot of pain female experience for the throughout the 9 months. Sometimes it can be because of the sexual intercourse which is happening, and that time also diastasis pubis can happen. But that definitely you have to talk to your gynecologist what exactly is the issue, what is the root cause, and how you can be able to correct it. There are multiple postural changes female face because of the abdominal size is increasing. Center of gravity, as I just mentioned, it is shifting anteriorly. So automatically the protracted shoulders are going to happen. The hyperextension of the knee is going to happen. Protraction of the shoulder automatically pulls your neck front, a little bit of head front, and that also causes a complete pressure on the upper abdominals, the upper back, and as well as the neck postures. So that means your cervical spine and the thoracic spine are going to be into the more of tightness as compared to the other body parts. So those are the things which are going to cause a more pain to you, or otherwise going to cause a protractions of the shoulder, which also increases the lumbosacral angle, increases the lumbar lordosis and the thoracic kyphosis, which I just mentioned. The muscles are going to become more tight at the site of thoracic spine, and the more lax at the time of your at the place of your lumbar spine. So because of that, the stretch muscles become weak, and the lordotic muscles and the kyphotic curves are going to get increased. So automatically the center of gravity pulls front anteriorly, and it causes a lot of postural changes in the female's life at the time of even walking, even at the time of standing. They might can also balance at the time of they develop the wide base of support if they have to stand, or otherwise they develop a waddling gait. But those are the things which we have to take care at the time of physiotherapy exercises protocol development. So these issues in the female's life they can face on a very minor level, or otherwise it will be very negligible, and they'll be able to live their life independently with a very balanced way. Role of physiotherapy in the antenatal care. So how exactly physiotherapy is going to help you in the antenatal care, that part we are going to start right now. I am not actually going to tell you what are the exercises you all have to do, because exercises is something from person to person can differ because of the condition of that person. And there are basic things which are applicable to all that I'm going to show you. But the prevention and the treatment of the musculoskeletal problem is the basic thing which we are going to do it in the physiotherapy. Promoting a healthy lifestyle, which are going to modify the ergonomic postures, the postural and ergonomic advices are going to give to them. We are going to prepare them for the labor. We are going to teach them the breathing exercises, then the relaxation exercises, optimal physical fitness as per the person to person we are going to do as by the doing an assessment, and we are going to teach them based on that. These are the certain exercises, certain stretches female actually do at the time of pregnancy, which are applicable to most of the female, but not all I can say, but that differs from person to person. That's why I said the assessment is very important before prescribing anything to the female who is undergoing the phase of a pregnancy or the delivery at the or otherwise a postpartum period. Whenever we start exercises at the time of pregnancy, it reduces the common complaints of the pregnancy such as fatigue, varicose veins, swelling of the extremities. Fatigue is something which every woman is going to face some or the other time, like the first trimester or the second trimester or the third trimester. But definitely fatigue is going to be remaining there. We can reduce it, but we cannot make sure that the person is not going to get fatigue at all. Varicose veins is something definitely associated with the muscles laxity or the circulation issue. You are going to do a physiotherapy in a proper manner. We are going to activate your muscles. We are going to make sure that you are activating and doing an exercises for those muscles. So at a certain extent, we can reduce the chances of getting varicosities for sure. Then the swelling of the extremities can be controlled, can be reduced, or can be maintained for the throughout 9 months by doing a good exercise or the vigorous exercises for the calf muscles or the lower extremity exercises. So it will be helpful or to reduce these kind of complaints in the pregnancy. It reduces insomnia, stress, anxiety, and the depression. Whenever person do certain exercises with the which are suitable for his body, automatically happiness hormones start getting secreted. Because of that, automatically stress and the anxiety and the depression kind of an issues we can overcome. Insomnia is most of the female experience in the third trimester, or otherwise sometimes in the second trimester also they can experience. But that time if they are facing those issues, those exercises can be a breathing exercise, can be the relaxation techniques, can be a good exercise physiotherapy, can be the chair exercises, chair yoga kind of an exercises. Those help to reduce this kind of an insomnia, stress and anxiety and depression kind of an issues with them. Weight bearing exercises reduces the length of the labor and prepare the woman for the physical demands of the labor. There are certain misconceptions that you are not supposed to do exercises in the standing posture. You have to lay down or you have to sit and then only you have to do an exercise. No, the repetition has to be less. The number of doing a frequent exercises has to be less. But definitely there are exercises which you can do it in the weight bearing position, can be a standing position, can be a proprioceptus exercises, definitely help to maintain a good postures as well as to maintain the stamina of the muscles against gravity at the time of which is also going to help you to reduce the length of the labor and prepare the woman for the physical demands of the labor. Because labor is something which is very painful condition. That time you are going to be in such a phase of your life, you are going to experience pain, there will be muscle contraction, there will be cramps in the legs as well as cramps in the stomach, there will be continuous contractions in the back muscles. You will not be able to into a stable postures. And those changes are not only going to be associated with your only stomach, entire body is associated with that labor pain. So that time your all the muscles should be ready to take that pain, and that pain will be easy, definitely not less, because every woman has to go through that. Every woman is going to experience labor pain at the time of delivery, apart from the cesarean section or the some other kinds of surgeries. But definitely labor pain, that woman if who is going to experience have to have a good physical fitness which will help them to overcome those kind of pain, or it will be a very easy process for them. Improves core stability and the pelvic floor muscles strength. Why this is so important is because the body entire body's anterior the center of gravity is shifting anteriorly, and at the same point of time your pelvic floor muscles are also get active. You are going to stand, you are going to do certain activities, those muscles are going to require to take the entire weight of the baby who is developing inside your womb. So that time these core muscles, the pelvic floor muscles, are going to help you to maintain that kind of an weight, and definitely it will help you even after the delivery, that means in the postpartum period, because those muscles definitely start showing symptoms if those are weak. So you have to make sure that you are activating core as well as the pelvic floor muscles. It improves the glycemic control. There are certain female who personally I can say I had a gestational diabetes. So that time I was the one who didn't prefer to go for the medication. I came to know in a very early stage, and I maintained it with the good exercises, good balanced diet, as well as with the complete relaxation techniques. So it but definitely physiotherapy helps to maintain the glycemic control. Protective effects on the coronary heart diseases, osteoporosis, and the hypertension, because the good circulation, good muscle activation is going to help you to maintain those kind of overcome these kind of issues. Improves posture, strengthening of the muscles and maintaining muscle strength, length and the flexibility. Definitely once you are into exercises, everybody know that it is going to improve the muscle length as well as a good strength is going to get generated into that. So definitely it helps to improve your posture, because correction of the posture is something which is associated with the muscular tightness or the lengthenedness, or otherwise it is stretching. So when you are going to be into the good muscle length, automatically your posture improves and you will be able to maintain a good well-being of the for the throughout the day. Decrease birth weight and a less maternal weight gain. This is something very common issue everybody face after delivery, that I have put on lot of weight. Those weight increased BMI and weight gain is very difficult for the female to come to the normal when you have already gone through the delivery phase and now you are into the postpartum period. Before that only, in the ANC time, you can start working on your BMI. Yeah, yes, for sure you are going to increase into the weight to 10 to 15 kgs increase in the weight from the normal routine weight is completely acceptable. You are going to be into very for the initial 6 months you are going to maintain it very less, but definitely later on it will be very easy for that mother to reduce the weight. But to avoid all this kind of an issues and come back to the original weight for the lifetime, it is very important that you should start working on it at the time of antenatal care itself. Improves the feeling of well-being, helps in achieving the pre-pregnancy fitness levels. There are certain contraindications which are absolutely in this condition you're not supposed to do at all a physiotherapy. There are certain things which I have mentioned over here. The hemodynamically significant heart diseases like ischemic heart disease, rheumatic heart disease, or the congestive heart failure. In that condition, if you are pregnant, you are not supposed to do physiotherapy at all. Certain physiotherapy exercises can be ankle toe movements, certain heel press, or any kind of a small which are non any kind of a pressure is not going to generate on your muscles and it is not going to cause any kind of an heart issues to you. Then definitely under the observation you can perform certain exercises, but not actual physiotherapy which we prescribe for the pregnant woman. Then the placenta previa, preterm rupture of the membranes. This particular phase I had gone through, so I know this is very delicate phase, and you're not supposed to do that because the pregnancy-induced hypertension, then the history of preterm labor. Labor is something which people can experience at the time of 4th month or the 5th month or the 7th month. At the time of this kind of a preterm labor, if there is a cerclage has to be done. Cerclage, that means the stitches are given to the cervix, so to protect the baby. It should not the delivery should not happen early, so those kind of a things, if the female is going, then that time it is important that you should completely stop your physical exercises to protect that stitches, or otherwise to avoid the preterm rupture of the membrane, or otherwise if there is a preterm labor, then also you have to take care of your body as well as to avoid any kind of strenuous exercises on the daily basis. Pregnancy induced hypertension is something which you have to take a bed rest on the left side, because circulation has to get maintained and baby should get a good circulation. The hormonal balance has to get maintained to the baby as well as to the mother. So it's important that you should stop doing an exercises or the over strenuous exercises to avoid any kind of an injuries or the damage to the fetus which is developing inside your womb. Incompetent cervix, acute infection, thromboembolism or the pulmonary embolism, persistent second or the third trimester bleeding, or otherwise in not only the bleeding, even there is a lot of discharge, the white discharge or the white watery discharge has started happening because of your strenuous exercises. Immediately you should stop, immediately you should consult your gynecologist and you have to stop exercising vigorously, or otherwise if you're doing it for the 30 minutes you can make it up to 10 minutes, but definitely under the observation of the gynecologist and a physiotherapist. Intrauterine growth retardation, if there is amniotic fluid is lacking inside the body, and then you are every sonography is going to tell you the number of how much is the amount of the amniotic fluid inside your body. Now what are the there are double marker, triple marker kind of a test which are very advanced tests which are going to tell you about the growth of the baby. So that time if you are finding any difficulty or any kind of an abnormality, you are supposed to talk to your physiotherapist as well as your gynecologist, and that time in coordination with both of them they are going to change your actual physiotherapy, or otherwise they might can take an action that you have to stop physiotherapy. So those things you have to take in consideration at the time of doing physiotherapy or otherwise stopping physiotherapy. There are relative contraindications which you can think about: chronic hypertension, extreme morbidity, morbid obesity, poorly controlled seizure disorders, mild to moderate cardiac diseases, severe anemia, twin pregnancy after 28th week, exercise-induced asthma. These are the certain contraindications which you have to take in consideration. At the same point of time, I will tell you the signs to terminate physiotherapy exercises. As I just mentioned, you have to always keep informed to your physiotherapist or otherwise a gynecologist about the symptoms which you are facing. So that time, certain exercises which you are going to stop, those are the contraindications I have already mentioned. Now, what are the signs that you have to terminate? That excessive shortness of the breath. Sorry, if there is something. There are certain signs which help you to understand the termination of the physiotherapy exercises. Is right now you have to take the decision for that. There is a excessive shortness of the breath or the chest pain or the palpitations. If there is a painful uterine contractions, it can happen in the preterm labor as well. Pre-syncope or the dizziness, the vaginal bleeding, excessive fatigue, abdominal pain, reduced fetal movements or the leakage of the amniotic fluid. These are the certain things which you have to take in consideration, and then you have to take a decision about it, that you have to stop the physiotherapy or you have to continue the physiotherapy with the less vigorous exercises. Exercises risk during pregnancy. What can be the maternal risk or what can be the fetal risk people are going to face? The musculoskeletal trauma, the supine hypotension syndrome, certain times female can fall, or hypoglycemia can be the thing which female can face if there is a physiotherapy which are going on, or otherwise exercises which they are doing it which are not suitable for them. Certain times the fetal risk are like fetal distress, preterm labor, or abnormal rise in the temperature. You will definitely come to know those many symptoms. If something is happening, there is a leakage of the fluid, or otherwise there is a less movement which you are feeling, or otherwise there is a lot of contractions you suddenly start experiencing. Those are associated even with the constipation. Those are associated even with the exercises which you have recently done, and then you started experiencing those symptoms. Then you have to immediately stop physiotherapy, or you have to inform to the gynecologist as early as possible, or you have to inform to the physiotherapist immediately, yeah, I'm experiencing these kind of symptoms. Exercise prescription in the pregnancy is based totally on the assessment of the fitness level of that particular female for the throughout her life. If she has done something or not done something, it is completely an individual goal. The type of exercises which anybody can do is an aerobic exercises, walking or the swimming, resistive exercises or the flexibility exercises, which are also going to get designed by the physiotherapist. Intensity can be maximal heart rate is 60 to 70% for the poor woman who were sedentary. Then 60 to 90% for the woman wishing to maintain the fitness during pregnancy, who are already to fitness and now they are wishing to maintain their fitness during pregnancy. Then the box scale of the perceived exertion. Box scale and all those kind of an R comes under the expertise of the physiotherapist or the exercise medicine specialist. Those people are going to assess and they are going to tell you this is your fitness level, these are the intensities applicable for you, and this is how exactly from the slow to fast or fast to slow we are going to design your protocol. Whenever we are considering the physiotherapy exercises or the fitness exercises at the time of pregnancy, you always have to remember from the first trimester to the third trimester, the intensity, the duration and the frequency is going to get reduced, not increased. Because once we start going to the gym, that time from slowly you start progressing, and then at the end of 6 months or 7th month you are completely into the good fitness level. But at the time of pregnancy, when you are into the third trimester, there are more chances you will do a damage to your baby inside the womb if you are doing a vigorous physiotherapy. So avoid doing that. Make sure that when you are going to be in the first trimester, you can do those things, but those are not mandatory things which you will be able to do it in the third trimester. Start from the 15 minutes and progression up to the 30 minutes, not more than that. You can do it minimum of 3 times a week. Then the proper warm up and a cool down period for the 5 to 10 minutes each and every session prior doing an exercise and post doing an exercise is mandatory for every female. Progression to 4 to 5 times a week can be done if it is allowed or if it is permitted by your gynecologist and a physiotherapist after the assessment, but not mandatory at all that you have to perform 4-5 times a day, 4-5 times a week, because as the baby is growing inside the womb, the nutrition is also going to provide to the baby, as well as your body also needs a nutrition to maintain that fitness level. So make sure you're not straining yourself to make that goal happen to you, because there are certain female I came across, they are like, yeah, I'm not able to walk up to the lift, but still I want to do an exercises. Don't do that. Your body is demanding now the rest, so give that rest to that particular body, because that baby needs rest. Whatever your body is demanding are now the demands of your baby, so you have to make sure that whatever you are doing, it should be in consideration with your baby which is growing inside your womb. General guidelines for the exercise in the pregnancy are the physical examination is must. As I said, you have to visit a physiotherapist, then you can get your physical examination done, and then only you decide about a physical fitness protocol. The jerky, bouncing, ballistic movements, activities should be avoided. Warm up should precede excessive exercise session followed by the cool down and a gradual decline in activity. As I just mentioned, first trimester to third trimester, you have to make sure that whatever exercises are applicable as per the trimester only you are going to decide for yourself, not going to force your body which others are able to do it, why I am not able to do it. Don't compare, it is for individual goals, so you have to make sure that you are going to focus on your own body and your baby's demands. Maternal heart rate should not exceed 140 beats per minute. Otherwise, there are chances that fetal can go into the distress. So it's most important that you should keep a complete check on the heart rate. Do not overexert, overstretch joint, or rapidly change directions. Avoid Valsalva manure or avoid contact sports. No prone position after the first trimester. As I always say, prone position that person should avoid even in the first trimester, because when you're lying into the prone position, it is continuously putting the pressure onto the growing uterus. So it's you have to avoid those kind of an issues in the near future. So best is that you have to start lying down. You have to stop lying down in the prone position after the first trimester itself. I'm in the following slides, I'm going to explain what are the good postures for the sleeping, what are the activities which are normal daily activities you have to follow the postures, but you have to stop sleeping on the back in the first from the first trimester itself. Avoid exercises in the supine after the 4th month. After the 4th month, the baby's weight is increasing rapidly, and that is putting a pressure on your spine as well as in the vena cava. So those things are going to affect even in your breathing pattern, your circulatory pattern. You might can develop a cramp, or otherwise there is a breathlessness also you might can develop. So avoid exercises in the supine position after the 4th month, which I advise normally for the people. You can do it in the sitting, you can do it in the standing, or you can just do a simple walking, which is advisable by the body. No pain, no gain does not apply. As I just mentioned, it is not a gym fitness exercise. It is your pregnancy fitness exercises. So make sure according to your body, you are going to do all this kind of an exercise. Fluid must be taken before, during, and after exercise to avoid dehydration. When you're going to do an exercises in the other protocols, you generally avoid to have a liquid whenever you are going to do an exercise. But in the pregnancy physiotherapy, we generally advise you take before, during, and after exercise to maintain a good hydration. Because if you're not hydrating yourself, automatically you get fatigue very often. There will be breathlessness, as well as there will be a lot of sweating because of the exercise, and you will not be having a good hydration. You might can go into the restless kind of an issue. So it's important to have a good fluid intake at the time of and even at the time before and during the exercise session. Empty bladder before exercises and avoid GI discomfort by eating at least 1 hour prior to an exercise. Strenuous exercise must be avoided in the hot, humid weather or when a pregnant woman is pyrexial. Horseback riding, gymnastics, cycling during the pregnancy are not allowed at all, because cycling is something which is going to again put a reverse pressure on the uterus. So it's important that you're not going to do those kind of bouncing movements or otherwise any kind of a balancing action which are going to cause any kind of a damage to the growing uterus, or otherwise the ligaments or the soft tissues around it, or otherwise it can cause a good laxity to the all muscles which are already getting lax. or otherwise you are going to do any kind of a jumping or any kind of a excess weight bearing activities to avoid any kind of a damage to the baby who is getting developed into the womb. Certain relaxation technique which I personally followed, and I also suggest to the people to do that. The Michel method is a physiological relaxation, the reciprocal relaxation of the muscle. There are certain apps are available on the internet, or otherwise you can check with your gynecologist if they are providing it to you, or otherwise the physiotherapists who are already running their clinic, they must be having those kind of an instruction CDs, or otherwise they have put it on the internet. Those kind of a relaxation technique with the instructions you can do, and you can make yourself completely relaxed. Contrast method at the Jacobson relaxation technique, which is something we alternately contracting and a relaxing muscle group, which you can do it by your own also by giving a good any kind of an order to your muscle, like a simply hand muscles or the eye muscles or the lips muscle. You can tell that you are now completely relaxed and you're contracting, then relax and contracting, then this way you can proceed further. The breathing exercises like a pursed breathing, deep breathing exercises, active mobility exercises along with the breathing exercises you can perform. So it will be a good relaxation for your body. Visualization and imaginary is something which I generally tell people. If you're getting restless or some kind of an emotional issues are going on, that time you can sit in front of the candle, you can focus on that and you can do that visualization or the imaginary, and you can tell yourself in the positive affirmations, and you can sit and continuously do the relaxation technique for at least a month or otherwise a week, so that you can calm yourself and you can maintain your good well-being. Touch and massages, which generally we advise to learn properly and then do it. That's why I have not mentioned any kind of an video or any kind of a technique over here to show you all how to do the massage or otherwise how to do the touch techniques. So the generalize one example I can tell you, you can keep your both palms resting on the growing belly. You can talk to your baby in the positive affirmations. You can think that baby actually is listening to you and they are going to develop a good communication as well as a good bonding with you. So that touch and even the massages on the abdominal belly, definitely those are under observations, and you have to learn those skills and then only do it for the upper body, lower body as well as the stomach. But those are very effective methods that which will cause a good relaxation to you. Whenever you are into the physiotherapy at the time of antenatal care, it improves the labor stamina, which is most important, improves the good flexibility, which is going to help you at the time of antenatal and the postnatal care as well. It is going to relieve the back pain, it strengthens the pelvic floor muscles, it relaxes and unwind. Prevention treatment of the musculoskeletal problems with the physiotherapy. Back and the pelvic girdle pain is pretty common, which I just mentioned. The prevention activities that reproduces the symptoms should be avoided. Proper postural education is important. Gentle massage, hot packs, TENS, certain kind of stretching exercises are going to help you to overcome this kind of pain. Sacroiliac joint dysfunction. The support belts which are available, you can talk to your physiotherapist, you can design it for yourself, or otherwise you can get it on the internet. Those are the basic one, but definitely you can take advice from your physiotherapist and you can go for the support belt. The various self-help manuals can be taught to relieve the sacroiliac joint pain. As I just mentioned, you have to do it under observation. So these are just pictures which I can show it to you, but you have to do it under the observation and then only you can do it. So the stretching or the good relaxation, you can give it to your muscles and the body as well. Symphysis pubis dysfunction, which is pretty common because of the lax muscles or the soft tissues. Diastasis pubis, rest and the re-education of the non-essential pores. So keeping the leg adducted. Then avoiding single leg stance. Avoid long stride when walking on uneven surfaces and excessive use of the steps. Gentle isometrics of the hip adductors, pelvic support belts, and the ice pack are one of the physiotherapy remedies which you can do it for the symphysis pubis dysfunction. Oxytania, that means the pain at the coccyx. A cushion can be placed at the time of sitting if you're going to sit in the prolonged period of time, if you're a working woman, or otherwise if you're going to sit for the prolonged period of time, if you're on a bed rest. The gentle mobilization, ice pack, heat, ultrasound is one of the machine electrotherapeutic modality. TENS is one of the electrotherapeutic modality, but definitely physiotherapists are the right person to understand ultrasound or the TENS, which modality is advisable for you, or both the modalities are applicable to you. That is completely an individual difference, and you are going to take it consideration with the physiotherapy advices. pelvic floor dysfunction is something which you can face from the first trimester, or otherwise you can face mostly in the third trimester when the actual belly has grown up. The stress incontinence, increased risk of the pelvic organ prolapse if there is a lot of muscular weakness. Kegel exercises, Kegel ball or the weights, vaginal cones, electronic Kegel exercises, electrical stimulators, that is electrical muscle stimulator. Electromyography can be used to train control, interferential therapy. Very rarely we advise interferential therapy, because if the TENS is working, then very rarely we use interferential therapy. Bladder retraining programs are something with the exercises along with the muscular contraction and a relaxation method, or otherwise a relaxation technique we can teach them. This pelvic floor dysfunction can be maintained, but definitely it is going to get reduced and you are going to maintain it, but it is not going to get cured at the time of ANC period. Nerve compression syndromes, carpal tunnel syndrome, ice pack, resting with the hands in elevation, ultrasound, splinting limiting restriction, posterior tibial nerve compression or the myalgia parastatica. That means, as I just mentioned, if there is a nerve compression, there is a edema or the water retention inside your body because of the hormonal changes, it puts a pressure on the nerves, and these are the issues you can face. Certain times ultrasound electrotherapeutic modality of the physiotherapy is going to help you. At the home you can definitely apply ice on those painful parts, and otherwise the splinting, that means a support system to that particular part, is going to help you. These nerve compressions can be continued at the time of your postnatal period as well. So those things, the same application, you can do it at the time of postnatal period too. Varicose vein is avoid standing or the sitting for the prolonged period of time with the legs dependent. When you're not taking any support for the foot, if your legs are hanging for the prolonged period of time, or otherwise you are standing by keeping your feet together, that means the base of support has altered, is very less, and a frequent or a vigorous ankle dorsiflexion, plantar flexion is not able to perform because of the continuous edema on the feet. So that time varicose veins development is pretty common, or otherwise you can face those issues because of the genetic or the congenital issues as well. So that time you can start doing an ankle toe movements, that means a dorsiflexion, plantar flexion, brisk walking, elevate the feet when sitting or the laying, or elastic stocking may be worn. Sciatica, reducing the activity level within the pain-free range, avoiding positioning which are going to put a pressure on the back, or otherwise take a proper support system, can be the lumbar support pillow. Postural corrections, that means an ergonomic advice which are coming in the next slides, are very mandatory for you. Muscle cramp can be the calf stretches is going to help you. Massages, deep kneading, tell somebody to do it for you. It will be good help for you, and it will be a good relaxation as well. Vigorous foot exercises are going to help you, but if you are on a bed rest, then that time you can do it with the passive exercises and you can maintain those muscle cramp. A pre-bedtime brisk walk, vigorous foot exercises, and a warm bath may help as a prophylactic method for them. But definitely muscle cramps on and off are going to be present there, and you have to deal with it with a good exercise fitness protocol. Women with the special needs, the one is the gestational diabetes. Walking, stationary bicycling, low impact aerobics, and swimming, along with the low carbohydrate and a high protein diet. 5 to 10 minutes of warm up and a cool down period involving some flexibility exercises, and the precautions including monitoring of the blood glucose almost every week, every day before it is coming to the normal, scheduling rest periods, and carefully tracking the fetal activity and the uterine contractions if you are suffering from the gestational diabetes. Pregnancy-induced hypertension or the preeclampsia, eclampsia. Bed rest is advisable. As I just mentioned in the previous slide, that you have to lie down on the left side position so that there will be no compression on the venous return, which is going towards your heart. Competitive athletes is something which we have to take in consideration, because for those people who are into the competitive athletic sports, then those people generally face issues with the conceiving because of the hormonal imbalance or some sort of an well-being of that particular woman. The major concerns are the effects of the pregnancy on the competitive ability. The second is effect on the strenuous training on the pregnancy. Constant supervision by an obstetric care is provided. You have to visit it on and off, whatever may be the symptom. If there is something not with the normal pregnancy routine, then you have to immediately go and check yourself. Additional evaluation to assess fetal growth and well-being has to be done. You already have to inform your gynecologist and obstetrician that you are into the competitive sports, you are into this kind of a field since these many years, and this is how exactly you have managed your lifestyle, and these are the things you are going to do it in a daily routine. But you have to but you want to continue with this pregnancy and you want to have the baby, then this is how exactly you have to follow the routine with the diet as well as with the physiotherapy fitness. So that time physiotherapist and the gynecologist will help you to maintain the fetal growth, the well-being, as well as to help you to give the guidelines for the effect, how to avoid the strenuous training or at the time of pregnancy. Women at the workplace. Nowadays IT industry is going so fast and people are into the more of sedentary lifestyle. Those have to taken in special consideration. At the time of COVID, most of the people were sitting at home, they were working from home, or otherwise sometimes you are going to sit in the office chair for the prolonged period of time. So work related stress, injuries, diseases, or the discomfort, which we call it as a musculoskeletal disorders as well, so those things can be analyzed and can be reduced if you are going to take in good ergonomic analysis and good ergonomic advices. Control of the risk factors by making modifications in the task or the working techniques. Ergonomic advices and the postural corrections as per your professional requirement. It's mandatory for the women who are going to work for the throughout 9 months, so that they will be avoiding any kind of an injuries to the growing womb or otherwise to themselves in the even in the near future. Postnatal care. Now we are going to start. We have just finished the part of the antenatal care. Now we are going to switch to postnatal care. Postnatal period is the period following delivery during which the new mother body begins to recover and return to the normal. Role of physiotherapy in the postnatal care is introducing an exercise and a relaxation program which is mandatory for the mother who has just delivered the baby, thereby assessing the new mother's physical recovery, restoration of the muscle strength and the tone, which has already got into the laxity. She has put on a lot of weight. There will be a lot of imbalance in the tone and the strength of her body muscles. So that restoration can be done at the time of postnatal care in the physiotherapy. Treatment of the musculoskeletal issues which she had at the time of antenatal period. Now she is going to treat it in the postnatal time. Teaching correct ergonomics for the breastfeeding, handling the baby, and the household chores. Using this opportunity to educate the mother regarding the various family planning methods and its importance. Family planning is very important for the overall well-being of the woman when she is into the postnatal period, because immediately conceiving again the next one might can damage to her body if she has conceived in the late age, at the age of 35 to 30, at the time of 40, or otherwise it is related to the IVF conceiving. Then those things we have to tell those parents as well as that woman who is undergoing those kind of an postnatal period. Providing support and counseling and helping to cope up with the stress. Some new changes have started happening into the woman's life. The baby has come out. Now she is also recovering from the hormonal imbalance, as well as the new baby is in her hand and she has to take care of her as well as her baby. So that time she might can go into the stress. The family support is utmost important. The second important that helping, she has to feel very free to ask to somebody's help that I am not well, I need your help. So those kind of things she has to understand, that kind of a counseling has to be done. This is the period when she need the most of the time helping hand as well as a good emotional support. So those things can be cope up with a good counseling and helping cope up with the stress. Educating regarding importance of the postnatal exercises and the breastfeeding. Physiotherapy following the normal vaginal delivery. These exercises you can start immediately after delivering the baby also, because there will be bleeding for the at least 1.5 months or something that she is going to experience even after the Caesar, even after the vaginal delivery. That time she is already weak because the delivery has already happened. So you're not supposed to go into the vigorous exercise protocol. You have to develop it with a very simple exercises. Can be breathing exercises, can be the pelvic floor muscle strengthening exercises, can be an active movements of the limb, can be a good walking in the fresh air. These are certain exercises: pelvic tilts, gluteal sets, single knee to chest. There are a lot many exercises which we can treat as per the individual goal. Cat and camel exercises, single straight leg exercises, abdominal curl-ups, bridging she can perform. Following the cesarean section, if she is experiencing a lot of pain, even with the painkillers and certain relaxant, if it is not helping, those are not helping her, then you can definitely think of an option for the TENS, for the pain relieving modality. Diaphragmatic breathing and a segmental expansion exercises are mandatory for her. Even she has to start it as soon as anesthesia is getting relieved, because when she is doing those exercises at the time of the next day itself, she has to start to overcome anesthesia effect, and she will not develop any kind of a cuff or any kind of another injuries to the muscle. The splinted cuffing she has to perform to get out of the effect of the anesthesia which she has. Can be the spinal anesthesia, can be the GA. Generally, we never give GA at the time of cesarean section. It is always a spinal. Now it has more become advanced. There are many other types of also, it is very small surgery. So those time, to avoid those kind of an effect of the anesthesia, we give the splinted cupping. Knee rolling can be done to give the good relaxation to the abdominal muscles. The movements of the limb, pelvic floor exercises, pelvic tilt and bridging exercises can be done after the 3 to 4 days or the 5 days after the cesarean section, because already the stitches are there, and she has to perform those exercises within the range to avoid any kind of pain. But to get a good relaxation, she has to start immediately mobilization. That means walking, climbing, or the otherwise standing from the next day itself. Whenever the catheter is going to get removed, the anesthesia effect has completely gone, and now she has to sit and go to the toilet activity. That time the basic activity she has to start with the movements of the limb, and then later on it can progress to the more advanced protocol for her. But the vigorous activities of the physiotherapy or otherwise in any kind of a yoga therapy, she is able to perform only after the 6 to 8 weeks. That means that 2 months she has to give a complete relaxation to her body, and she has to perform just gentle stretching exercises, or can be just a good walking exercises. Then only she'll be able to join the vigorous exercises when the stitches are completely healed, her stomach muscles are coming into the completely neutral, her bleeding has completely stopped, and she is into a good well-being of her, and then she can start with the vigorous exercises. Postnatal problems under physiotherapy can be perineal pain. Rest and apply an ice for the 10 to 15 minutes is going to help you a lot. Pelvic floor exercises using contract relax technique, the relaxation techniques with the contract relax technique, use of the cushions at the time of sitting. Electrotherapeutic modality can be an ultrasound, pulse electromagnetic energy, low level laser therapy, infrared, or the surfacing, which are very rarely we use, but ultrasound is pretty common, TENS is pretty common, which we require at the time of relieving this kind of pain. Diastasis recti is something gap between the recti abdominal muscles of greater than 25 mm. Palpate just superior to the umbilicus. As I just mentioned, if the time of antenatal period, if you're facing any kind of an weakness or any kind of an issues with the muscle, those are going to get continued at the time of postnatal time also. Or otherwise at the time of delivery, if the injuries had happened, if the muscles are got expand completely, the contractions are very high, that time also you can face this kind of an issue and diastasis recti can develop. To overcome that particular issue, you can do the isometric abdominal exercises, head lifts with the pelvic tilt, leg sliding with the pelvic tilts in quadrupole position. These are the basic one which I'm telling you, which you can just search and you can do it on your own, which are not going to harm you at all. But as I just said, if you want to overcome these kind of an issues for the lifetime or the permanently, then definitely visit a good physiotherapist and get yourself treated. If a diastasis is large, it is recommended to use a temporary abdominal support like an abdominal binder. Abdominal binder can be your good cotton dupatta, or otherwise it can be a good abdominal binder which is available on the internet or otherwise in the medical store. You can go and you can check for yourself, depending on the how diastasis is large. Strengthening of the weak muscles by low load endurance exercises, mobilization of the sacroiliac lumbar or the lumbosacral region in the case of the low back pain, teaching to maintain the correct postures and the correct ergonomics. Hot packs can help you to relieve the back pain. Thoracic pain, postural corrections, gentle exercises, hot and ice pack. Thoracic pain is something people experience quite and often because the breastfeeding is going on. Now the muscles are coming to a original position. Now the center of gravity has shifted to an original place because the baby is completely out of the womb, and those things now the affecting the back muscles also. So whenever the muscles are coming to the complete relaxation and coming to the original position and original length, these kind of postural corrections are required, and you can experience these issues for a very few period of time, but you have to treat it and you have to overcome those issues with a good exercise protocol. Symphysis pubis is an addition to treatment used antenatally. Other methods can be used here. The trochanter belt or the full pelvic binder. full pelvic bender, which is most of the time I have advised. Drawing the abdomen in the encouraged, drawing the abdomen is encouraged before moving around the bed. TENS US orthopedic aids. Many women experience at the time of turning from left to right, right to left, there is something moving inside, which is a severe contraction they feel for the initial few weeks at the time after the cesarean section, or after the sometimes even after the vaginal delivery as well, when the uterus is coming to the normal. That time you can go for these kind of an belts, or these are the movements which they can learn how to do it, and they have to strengthen those muscles, so it will help them to overcome these issues. After pain, TENS over T10, L1 and S2 and S4 that intervenes with the uterus and the perineum may relieve pain exercises are some of the things which you can take in consideration. Abdominal induration, moist pack or the SWT can be given to resolve the intramuscular hematoma, which I generally advised after the 6 to 8 weeks of the particular cesarean sections or the normal vaginal delivery, when the complete bleeding has stopped and now the person is still experiencing those kind of an abdominal induration or the pain, then they can go for the SWT kind of modalities. Circulatory problems can be the varicose vein, vigorous and frequent dorsiflexion, plantar flexion, pressure stocking, sitting or the laying with the leg raised. Edema definitely get reduced after the post-pregnancy, post-delivery, but vigorous ankle toe movements, resting with the leg elevated and pressure stockings are going to be the one of the solutions for those. Deep vein thrombosis is something when the person is completely sedentary, and that can, with the effect of anesthesia, something has gone wrong, or otherwise there is a gaping in the particular stitches. Vigorous ankle toe movements and the leg elevated. Avoid pressures on the back of the calf while carrying out any activity. The DVT is in the iliofemoral region is going to be there. The calf and the iliofemoral region are one of the most commonest site where the deep vein thrombosis can happen post delivery. So bed rest may be advised till the swelling subside. Legs in elevation. Foot exercises, quadriceps or the gluteal muscle contractions, hip and the knee flexion and extension can be to increase the good circulation. Bladder and bowel movements, the stress incontinence, the Kegel exercises, the muscle stimulators, or the electromyography or the bladder retraining, which we have which we are going to do it even in the antenatal care, which are same applicable in the postnatal care as well. Bowel incontinence or the constipation, if still continued from the antenatal to the postnatal care, then you have to definitely work on your core exercises, core muscle exercises, as well as your body fitness activity, and you have to take a laxative so to overcome those kind of issues along with the same Kegel exercises. If the female is facing any kind of a psychological problem, can be the maternity, baby, or the third day blues, can be a puerperal psychosis or the postnatal depression. If there is a breast engorgement, mastitis, or the tender or the cracked nipples, those things can be treated with a good massage technique, as well as good relaxation technique, as well as with the good physiotherapy, which is going to relieve you from the anxiety and the depression. If there is getting severe, then you have to consult a good psychologist. Now the ergonomic advices for the activities of the daily living for the ANC and the PNC period. When there are multiple positions and there are multiple pillows are available in the market, you can use even the any home pillow, which is going to give a support in between your legs, as well as for the growing belly, as well as for the good support system to the shoulder. So the shoulder should not roll forward and go into the protracted position. So you have to take a thickness of the pillow, which is up to the shoulder thickness, or otherwise you can just invest for yourself into the good C shape or the U shape pillow, which is available like this, and you can go for yourself for the throughout 9 months and get a complete relaxation at the time of sleeping. This is how you should get up always from the bed. You have to turn yourself, take your legs down, take a support of the hand and get up with a straight spine. This is how you can do the vomit, or otherwise you can do the brushing. You have to take the distance between two legs shoulder width apart, so that center of gravity will definitely pass through you instead of passing through any one joint of the body, so it will avoid any kind of bed bearing positions to you. This is how you have to spread your legs, bend forward from the hips, so the pressure will be completely on the hip, not on the stomach, or otherwise not on the back, so it will help you to overcome any kind of issues in the near future. So this is how you can do this kind of postures in the antenatal and as well as in the postnatal care. Squatting and lifting, this is how exactly you have to go down. Again, take the distance, go down from your knees, bend forward from your hips, lift the object and get up with a straight spine. Ergonomic technique which is required can be an ironing board, or otherwise you can stand, you are standing in front of the kitchen workstation. So that time, make sure that you are going to put a 2 to 3 inches footstool and then going to do any kind of a bending or any kind of a repetitive task. So it will relieve any kind of a stress on your spine as well as on the legs. This is how you have to lift any object. Take a distance, again bend down from your knees, bend forward from the hips and lift the object. But I generally advise from the first trimester itself, you're not supposed to do any kind of an overlifting. If you are into the cesarean section also, you have to take care of your muscles. Do not do weight lifting, because it might can damage to the healing muscles as well as it can damage to the future also. So make sure if the uterus is coming to the neutral, you are completely into the good fitness level. Even if after the vaginal delivery or the cesarean section, even in the antenatal care, you're not supposed to do any kind of a heavy weightlifting. Spinal alignments for the different bags. If you're going for the shopping, you are going to carry most of the time. I suggest you can take any kind of a sack bag. If you're not possible, then if you're taking any side bag, then take it on the back, on the hip, not at the side, so that the shoulder level going to get maintained. It will not cause any kind of a pressure on the stomach, or it will not get pulled back so that it will cause a back pain. If you're taking a briefcase, then definitely take something in your opposite hand to maintain the good alignment of the spinal cord. If you are going to travel, definitely in the third trimester, you have to make sure the travel for the shorter distance, not for the longer distance. Above and below the bump, not over it, which is utmost important, that you have to make sure how you're wearing a seat belt. 3-point seat belt should be worn throughout, because it is going to give a good support system from the any kind of vibrations which are coming from down. How to take care of your baby. When you're lifting your baby, you have to lift it from the shoulder, and then you are going to go down, you are going to bend, you are going to take a support system. It will be a good active position by keeping a one leg resting and one leg in the air, and it will be a good lifting positions against gravity. So you will not damage your spine at the time of lifting. This is how exactly people do the mistake. When they are sitting, if their feet are unsupported, if there is no back support, automatically baby as well as the mother both are into a good any kind of wrong feeding postures, and it can cause a damage to the spine, as well as baby is also not comfortable while taking the feeding. So you have to make sure you are in a good comfortable positions like this. Take one leg elevated. You have to keep your both feet supported, or otherwise take a one pillow from back. Otherwise, lying down and taking the support system, and make sure that baby is in the lying down position in the sideways and taking the feed. Whenever you are going to do diapering or the baby cleaning grooming activities, most of the female immediately bend forward from the hip. That time their knees are not bent, even the spine is continuously into the C shape. So that puts a lot of pressure on the spine, and it can damage in the future. So make sure you are going to keep your spine straight. You are going to make sure you are into active position, and then do any kind of a diapering or the baby cleaning and grooming activity. Or otherwise, you can always put a footstool over there whenever you are going to change the diaper or the baby cleaning grooming activity you are going to do on the bed. Just one simple footstool, keep your one leg on that and bend forward from the hip and do those activities. This is how exactly I suggest you for the bathing. People can do it in the any kind of a bathtub in the initial period if they are alone, or otherwise they can take a help of the elevators. Nowadays, even the bathtubs are available with the elevators. In the inclined position, you can keep your baby, and you can do all kinds of breathing activities. When you're carrying your baby, make sure that you're holding it for the bum, as well as you're keeping that baby in the middle, so it will not be putting pressure on any one side of your body. So in the future, you can avoid one-sided up shoulder, one-sided down kind of postures, or otherwise the one-sided contractions of the muscles. It would prevent even in the damage in the future. This is how exactly you can carry baby in the sling. Front carrying is something which I always advise to the parents, because when the baby is facing front, they are able to see each and every person. Then automatically they are very happy, and even they are not going to show any kind of a tantrums to the mother. So even the baby and as well as the mother both are in the very comfortable positions when they are walking by wearing the sling. If the baby is not well, they make sure that baby is facing to you, so they'll feeling the warmth and the comfort position. So it will be a good relaxation for the baby as well as for the mother. When the active playing activity is going on, can be the front position or can be the back position, can be maintained with the sling. These are the certain pillows available in the market which call it as a breastfeeding pillow. You can use it at the time of feeding, or as well as can give it to your baby, so it will be a good comfort position for them, and they feel secure into that particular pillow when they're sitting over there. When you're teaching baby to walk, or otherwise using a stroller or otherwise a pram, that time you can make sure that your spine should be straight. You are going to little bit bend from the knees, and then you are going to make sure that you're bending from the hip, not from the spine, to avoid any kind of a damage in the future. If you have any questions, you can write down, you can ask me, or I have provided my mobile number. There is a WhatsApp to that, or otherwise you can directly visit my website. There is an email you can write down to me. So if any questions, any queries related to this website, this particular presentation, if you have anything, do let me know. I'll be glad to answer all these kind of questions to you. Thank you so much for being so patient and a wonderful audience and listening to me very patiently. If any kind of a thing which is missing into this, definitely you can add to those in the comment box. But definitely I have tried to cover as much as possible in this 30 to 40-minute session. If any thing which is remaining, we can definitely discuss over. And looking forward to have more questions from your end. Thank you so much. Thank you, MMA, for giving me this opportunity to as a resource person, and thank you for inviting me for this and considering my name. Thank you, everyone. Thank you so much.